Episode 7, High Triglycerides, the Underestimated Cardiovascular Risk. Welcome back to the Silent Killers. I am Dr. Chaitanya, an internal medicine consultant in Care Hospitals, Banjara Hills in Hyderabad. In this episode, let's uncover one of the most overlooked markers in your blood test, a silent warning sign that many doctors and patients ignore: high triglycerides. We often hear about cholesterol, total cholesterol, good cholesterol, bad cholesterols like LDL, but triglycerides are the real culprit, quietly contributing to heart attack, fatty liver, and metabolic syndrome. So what are triglycerides? They are a type of fat found in your blood. After you eat, your body converts excess calories, especially the calories which come from sugar and carbohydrates, into triglycerides, which are stored in fat cells for future energy. Sounds harmless, but here's the catch. When triglycerides remain constantly high, they become pro-inflammatory and dangerous. So why are high triglycerides a silent killer? Because you feel nothing, no pain, no symptoms until it's too late. High triglycerides are closely linked to atherosclerosis, hardening of your arteries, heart attacks, and high risk of stroke, fatty liver disease, insulin resistance, and diabetes, pancreatitis in severe cases. In fact, studies now show high triglycerides can be more dangerous than high LDL. What are normal and dangerous levels for triglycerides? Normal is less than 150. Borderline is 150 to 199. High is 200 to 499. Very high is above 500. But here's the twist. Even at borderline level, if your triglycerides are high and your good cholesterol, HDL, is low, your risk skyrockets. So why are triglyceride levels rising in India? High carb diet, white rice, rotis, sweets, fried snacks, excess sugar through sugary teas, sweets, biscuits, colas, sedentary lifestyle, long hours of sitting in the office, no exercise, alcohol, especially beer and sugary cocktail, undiagnosed insulin resistance and fatty liver. Even young professionals, late 20s, early 30s, are showing high triglyceride levels above 300. This was very rare 10 years ago. So Ravi, a 40-year-old marketing executive from Jubilee Hills, came in for routine checkups. His total cholesterol was okay, but his triglycerides were 390. He had no symptoms, just fatty. We focused on reducing refined carbs, added healthy fats like nuts, seeds, and ghee. Got him to walk daily for 1 hour. Within 8 weeks, triglycerides dropped to 160 without a single pill. So lifestyle and dietary changes matter. So how do you reduce your triglycerides naturally? Cut sugar and refined carb. No white rice, no bread, no biscuit, no sweet. Increase omega-3 fatty acid through fish, flax seeds, and walnut. Exercise daily, even brisk walking helps. Avoid alcohol or strictly limit it. Intermittent fasting under medical guidance can be helpful to reduce your cholesterol level. Fix insulin resistance because that's the root cause for triglyceride to increase. Don't just glance at your cholesterol report. Look at your triglyceride level. Take them seriously even if you feel normal. High triglycerides are often the first red flag of deeper metabolic issues. Spot them early, act quickly, and you can prevent a heart attack or a stroke years before it happens. If you know someone who's young, has a poor lifestyle, bad dietary habit, high stress, urge them to check their triglyceride. You might save a life. This is Dr. Chaitanya, and you've been listening to The Silent Killers. See you in the next episode.